I am, 40-something, and I...
you look wonderful.
Oh, well, thanks. But now this is really the time when my wrinkles are not going, there's losing elasticity.
They
it's
start
quite
to stay.
obvious.
You smile,
yeah.
they start to etch in a little bit.
And I
right?
find that my face, if I'm watching TV because my eyes are going, then I'm like this, and then I catch myself, wow, I'm in this position, I'm getting... So anyway, I'm
And that happens because of our muscle motion.
Right.
The hyperkinetic forces, the dynamic muscle motion brings in these lines. Listen, you're happy, you're going to laugh, you're going to cry, you're going to frown. These things create lines. The muscles under the skin contract and pull on the overlying skin, and that creates a tension. And with repetitive motion, the skin just remembers to hold on to those lines. And there are ways, if you're interested in preventing that and also correcting that. If you want to look at one of our slides, we have a Botox Dysport treatment slide that shows an eye, and on the left you'll see an eye with wrinkles prior to treatment. After treating with either Botox or Dysport, you get that relaxation. You can erase the lines and also prevent the lines because you prevent the muscle from contracting and pulling on the overlying skin. We have a second slide with a forehead that shows before. On the left is before with the wrinkles, and on the right is after treatment. And what it does for people, it helps to remove the tension and helps to erase the line. People can really start at any age. If there's someone who's a real frowner, even in their 20s, and they want to just prevent the lines, they can come in and they can have a treatment maybe once or twice a year, and they would use it more for preventative. Someone who might be older and they really notice the lines all the time, Botox Dysport would act as a corrective process to treat the lines.
I have so many questions here. Let's say I get Botox.
Right.
Are you saying also not only is it going to relax your lines, but does it slow down the process?
It does, because if you think about it, you're not allowing that muscle to contract and to continuously pull on the overlying skin. So it also acts as a preventative.
Got it. Okay. What are the side effects? Anything?
Okay, there's not too many. Actually, treatment with Botox Dysport is actually one of the world's #1 procedures because it's a very fast, effective, really almost no downtime procedure that one can have. If you take aspirin or Advil or Motrin, sometimes you can get a little bruise at the site of injection. Sometimes people can complain of temporary headache, although these products are used to treat headaches as well. There's really very little downside to having this type of treatment.
But is it a one-shot deal, or how long does it last?
It depends. On initial treatment, it may only last 2 to 4 months because the muscles are at their strongest. If you continue to do it, a lot of people stretch it out so that they're only doing it, they're receiving treatment twice a year.
Okay, twice a
year. They try to stretch it out to twice a year. There's some people who might come in 3 times a year, but it can be stretched out.